Hello, my name is Dylan John. I'm a recent master's graduate from the University of Louisiana at Lafayette. First, I'd like to thank you for taking the time to view our presentation, Gender Differences in Rate Myth Acceptance and Bystander Engagement. If you have any questions following the presentation, please feel free to email me at dylan.john1@outlook.com. Previous researchers have identified several factors that can influence engagement in bystander intervention to prevent sexual violence. Some of these factors include rate myth acceptance, bystander confidence, bystander intention, and gender. Researchers have consistently identified a negative relation between rate myth acceptance and bystander intention, and that both bystanders' rate myth acceptance and bystander intention can influence their intervention behavior. Researchers have also found that levels of rate myth acceptance and bystander intention vary by gender. For example, Amar et al. 2014 found that men reported greater rate myth acceptance than women, and also found that women report greater bystander confidence to intervene as a bystander. However, when looking at gender differences in bystander intention, there are conflicting findings. Some researchers find that men have greater bystander intention, whereas others show that women have greater bystander intention. Thus, the purpose of the current study was to further examine gender differences in rate myth acceptance and bystanders' confidence, intention, and engagement in bystander intervention. Our sample was recruited from our university's SONA website and included 167 undergraduate students with a mean age of almost 19 years old. Most of our sample identified as female, and 70% of our sample identified as white. Our measures included a modified version of the Sexual Assault Bystander Behavior Questionnaire, which assessed bystander attitudes, subjective norms, confidence, intention, intervention opportunities, and intervention behavior in reference to 12 specific bystander actions. We calculated bystander engagement as the ratio of behaviors engaged in relative to the opportunities participants were presented with. For this presentation, we only analyzed bystander confidence, bystander intention, and bystander engagement. To assess rate myth acceptance, we use the updated Illinois Rate Myth Acceptance Scale. This is a 22-item measure that presents various rate myths and asks participants to rate their level of agreement, ranging from 1, strongly disagree, to 5, strongly agree, and we calculated rate myth acceptance by averaging the score across all 22 items. Due to the sensitive nature of the questionnaires, we also included the Marlowe-Crown Social Desirability Scale to control for participants' social desirability in our analyses. Across the questions, we had 4 attention check items. For example, if you're reading this, select true as your response. A total of 9 participants were removed because they failed 2 or more attention check items. And we additionally removed 11 participants for reporting that they had more behaviors than opportunities to engage in those behaviors. We conducted a multivariate analysis of covariance to test for differences in rate myth acceptance, bystander confidence, bystander engagement, and bystander intention based on gender while controlling for participants' social desirability. The multivariate model was significant, showing a main effect for participant gender. This indicates that at least one of the aforementioned variables differed by gender. So to explore which variables differed by gender, we conducted 4 follow-up analyses of covariances, or ANCOVAs. As shown in Figure 1, there was a significant gender difference in rate myth acceptance, such that men had greater levels of rate myth acceptance compared to their female peers. As shown in Figure 2, the ANCOVA for bystander engagement was also significant, such that women had greater bystander engagement compared to their male peers. This indicates that when presented with an opportunity to intervene, women in the sample intervened 90% of the time as compared to men who only intervened 52% of the time. The ANCOVAs for both bystander intention and bystander confidence did not significantly differ by gender. So these results confirm previous research indicating that women have greater bystander engagement and that men have greater levels of rape myth acceptance. However, we failed to replicate previous findings suggesting that intention and confidence to intervene differ by gender. However, this is potentially due to our current sample. As previously mentioned, our sample was predominantly women and we only had 20 male participants. Thus, the lack of statistical power in the current analyses may have led to the null effects. Researchers should continue to collect data from larger samples with a greater proportion of male participants to determine whether the lack of significant differences here is a true null effect or if it was just due to our sample. Bystander intervention programs may benefit from continued focus on gender differences in rape myth acceptance and bystander engagement. And researchers should also further explore why these gender differences exist and how we can work towards reducing rape myth acceptance.